Now I would like to invite Dr. Vandita Singh, Associate Professor, Department of Pathology, AIIMS, to deliberate her talk on artificial intelligence in pathology. Over to you, ma'am.
Very good afternoon to all my honorable colleagues, seniors, and all the participants. And I thank the organizers for giving me an opportunity to speak on, to give a brief introduction to artificial intelligence in pathology. As everybody knows, pathology is a very visual branch, and there's a lot of image analysis and pattern analysis that we usually do. So the learning objectives for my talk would be to introduce the concept of artificial intelligence in pathology and its current status, to know its applications and effect on workflow efficiency in a pathology lab, to understand the factors that influence its adoption or acceptability, what are the regulatory processes that govern it, and how does the government of India support us, and what is the research being done in India. So the current routine applications of AI in pathology laboratories is that AI is nothing new to pathology. It has been used for the last 20 years in different forms. For example, as automated tissue processing, staining, generation of synoptic reports on laboratory information systems. However, in the last 10 years, what has changed is the advent of digitalized whole slide image technology, which has increased the use of digital pathology, which is now becoming more commonplace. There are a lot of options for whole slide scanners in the market, and they are all very good. So, what is this image analysis? We are all used to Google Images, and you can take a picture on your mobile and upload it on Google Images, and Google comes up with some introduction about some information about the image. So, can we do that in pathology? Take a microscopic image, put it on Google Images, and come up with a diagnosis? Possibly. Is this a future of pathology diagnosis? Maybe. But how and why? Pathology is a very pattern based approach to diagnosis, especially in histopathology and cytology. What is this pattern based approach? For example, on Amazon, you select a kutta and it gives you a prompt for all the similar looking kuttas that are available in the market. So we can do it in histopathological images as well. You have a pattern, and the system or the software or the PATH AI system will come up with all the differentials which look like that, have a similar pattern. But it may be a little more complicated because the slides have not read the books and the slides do not know about convolutional neural networks. So the software can identify a cell, but it still needs input of a pathologist for classification and a proper algorithm to be really useful. For example, suppose for those who are not pathologists, to make it easy for them, you can have a image, pathology image, which is broken down into 6 grids. And so what the digital slide scanner would do is simply to create an image or a collage. What a pathology AI system would do is to break up each of these grid into categories to classify them as cat versus non-cat in this collage, for example. And for that, so you need a whole slide scanner and you need a path AI system which tells you which part of the grids are cat and which parts of the grid are not cat. However, this objective cannot be set by the computer, and it is still the human's job to identify what parameters define what areas of the grid. So this combination of a slide scanned image with an intelligent path AI system is what is called as computational pathology. Computational pathology is image-based diagnostic, prognostic, and predictive algorithms which incorporate not only the histopathological image but also its clinical data, genomics, and proteomics, and come up with a most informed diagnosis. And how do they do that? By using different AI algorithms. For image analysis, the algorithm which is commonly used is a convolutional neural network, or CNN. What is this convolutional neural network? Like I said initially, you take up a whole slide image, you break it down into a lot of grids, and each grid will have its own data generated depending on the parameters being measured. And then they will be intelligently computed with the help of an intelligent pathologist to come up with a classification and also an uncertainty measure. But as you can see from this picture, you do require a pathologist right from the start to the end. So how does this AI really help if you still need a pathologist? It automates the whole process, making the screening time shorter and improves the turnaround time for the entire diagnosis to come up, and therefore it is useful. So the three important components for an AI pathology report would be a slide scanner, followed by an intelligent path AI system, and then good amount of information in the form of data, clinical details, ancillary test results, prognostic data, and predictive data. So the AI system is only as intelligent as a pathologist and only as good as the data which has been fed into it. So how is a traditional image analysis, which is usually done in a slide scanner, different from an intelligent deep learning powered computational pathology? In traditional image analysis, the tasks are, in a traditional image analysis, for example, a breast carcinoma. What the system would do is basically make it easy to count the number of cells, count the number of mitosis, score the intensity stain. But what a intelligent system would do is to collate this data with patient's metadata in the form of clinical history or treatment response, and then come up with information which is useful. So the advantages of this intelligence system is that it helps in improving concordance between pathologists. As we know, pathology in a lot of aspects is subjective, so inter-observer variation can be minimized. It helps improving our screening times and therefore improving our turnaround times, so that the pathologist is freer to focus on challenging areas and foci which look different. This can also help us in allocation of resources better and therefore improving cost effectiveness. So, what are the examples of uses of computational pathology? So, no organ system is immune to this. Right from gliomas to the prostate, there has been research on this everywhere. But the two important areas are predicting cancer outcomes from histology and genomics. That is, I give you a diagnosis of glioma grade 3, and the computer associates that with genomic data, which comes from another lab, and predicts survival for a particular group of patients. Similarly, in the prostate, the Gleason's grading for prostate cancer can be completely automated. However, the system still needs a pathologist, so a pathologist-centric pathology AI system is the way to go ahead. But this system is not without its limitations. As you can see, the same breast carcinoma can look different on two different slides. The same squamous cell carcinoma can look different depending on its grades. So there are these inherent limitations which can be overcome as long as the input data increases and there is more validation of the system, which needs to be supervised by an intelligent pathologist. Of course, it's better said than done. For example, as you can see in this image, Google always comes up with this captcha to identify the buses, which is easy in this one. However, here it says identify the cars in this collage, and there's only one which shows a car. So the software can always have a glitch because the tumors are not robots, neither are we. And therefore, the system needs constant input and feedback to update it and keep on improving its training modules. So, the applications for AI in pathology can be in research, they can also be in routine pathology clinical practice, and they are governed by regulatory issues and have their own challenges and opportunities. So, the major applications are in the area of improving workflow and diagnostic applications, also in prognostic and predictive applications, integration of data with radiology and genomics, and educational applications. How does it improve workflow? It decreases the screening time, it improves the quality, prioritizes the workflow to focus areas, and makes the pathology service more efficient, cost effective, time saving, and increases accuracy. So the future objectives for AI in pathology are therefore that you integrate all of these four different applications and come up with new classification tumors for pathology images, combining pathology diagnosis with prognostic data and massive, radiology images, etc. This might improve efficiency of a pathologist workflow, and it can help in training as well, training the pathologist as well as improving reporting system for the pathologist. So, how do we apply AI in pathology? Can it be in silo in a pathology laboratory? No. We need a multidisciplinary approach in which all stakeholders, including the patient as well as the clinicians, are involved. And the clinical utility of these imaging software needs to be looked at. So, we are not just looking at analytical performance of image analysis, but its real utility at the bedside. algorithms for each organ system have to be defined, and this has to be led or delineated by pathologists. And you need to validate the data on large cohorts, which in pathology, most of the cohorts are retrospective. So when we have all of this together, only then you can apply it properly in clinical practice. So what are the regulatory issues? Abroad, because this has been in the making for several years, College of American Pathologists, FDA and EMA, look at evaluating the performance of image-based AI algorithms, and they insist on applying the right level of evidence for the appropriate context. The context can only be given by a pathologist. All of these AI diagnostic tools can have to be validated in the laboratory before they are set out in the market. Right now, they are only on research basis. And all legal considerations favor assisted or augmented artificial intelligence versus automated use. That is, they insist that a human factor still be there in using this AI technology. In India, regulation is in the pipeline and hopefully will come soon. The government of India supports all endeavors incorporating AI in the health sector, and the private sector has lapped up these options. So a lot of private labs already have collaborations with Google and Microsoft and are using this technology. As far as research on AI in pathology goes in India, only the major institutes like PGI or RNR at Delhi have used this, who have whole slide scanners and path AI systems and the capacity and facility for cloud computing, who are doing this. The limitation basically is the cost of whole slide scanners, path AI systems, and the amount of cloud storage that is needed. There is always resistance and suspicion of new technology, and therefore new local training modules need to be started, and the data that is taken from different regions needs to be validated in order to really accept it. So the challenges and opportunities are that acceptability of AI in pathology is slower than expected, comparing it with radiology, where it is a norm nowadays. That is because of the black box nature of AI itself, because nobody really understands the algorithms of CNN and how they work. So also the value added by development of these algorithms needs to be balanced with the cost and disruption in a pathology workflow, and it should be applied in areas of most need. Also, different versions of laboratory information systems and HIS exist, and they are not compatible with each other because of proprietary issues which needs to be taken care of. And we always need high class IT infrastructure, large amount of data storage costs, which has to be provided. So to conclude, computational pathology usage is absolutely going to increase in the coming days because of the need for evidence-based precision medicine. Artificial intelligence does improve and streamline the life cycle in pathology labs and gives rise to more accurate diagnoses. Acknowledging its limitations and challenges is important so that we can improve the system. And the concept of augmented intelligence should be adapted versus just artificial intelligence, with human input in the form of pathologists, clinicians, and patients. We must guard against the human resource toll of AI. That is, people do become de-skilled. If the screening is done by the machine, the pathologist will probably lose the ability to screen a slide well. But we must reassure the users who are skeptical that AI can complement human resources but will never be able to replace it. I thank the organizers for giving me this opportunity to speak on this topic. Thank you so much.
That was an excellent presentation, Dr. Vandita. I think in histopathology especially, it is an image-based diagnosis, as you told. And for the whole slide scanner and the artificial intelligence machine, whenever it is prepared, I think I remember the earlier talk by Dr. Bhode, sir, when sir told about one story that in US, the researchers, they come up with an artificial intelligence model where they try to differentiate the simple tank from camouflage tanks, that is tanks hidden behind trees. And they checked it and they found that it is able to diagnose 100%, differentiate between the two. They presented it to the US Army. After checking, the Army rejected it. They told it is not able to diagnose. So after analyzing, they found that actually the artificial intelligence machine is diagnosing the simple tank because it was taken in a bright light day, and the camouflage tank it is identifying because it was taken in a dark light. So I think while preparing artificial intelligence machine in pathology, we also or the researchers should also keep in mind the confounding factors, that is, whether the stain is very bright or there is slightly stained, what about the sections, thickness, all those things should be taken care of. Okay, thank you very much.
I agree with you, sir. The whole concept with any software is garbage in, garbage out. If your data is not, if you have not defined the parameters, you won't get a good answer. And but the usefulness is that the more data you have, the system becomes better. So we should not be suspicious of the technology, but we must work with it to improve it.
Yeah, okay, thank you.
Thank you.
Now I request Dr. Sarita Ramchandani to present memento to Dr. Vandita.
Thank you. I'd like to request Professor Alok Agrawal, sir, to kindly present memento to our chairpersons.